Nurse practitioner board review courses, important information about prompt review academy. Okay, so we have, this is your pharmacokinetics. So we said what the body does to the drug. So these are the list: absorption, bioavailability, distribution, metabolism, excretion. And pharmacokinetics is what the drug does to the body. Then another one you need to know is the pharmacogenomics. Pharmacogenomics. So we talked about pharmacokinetics, pharmacodynamics, then pharmacogenomics. So this is the study of how a person's gene affects response to medication. So it's very important to know that, because some people, if they have a some kind of gene that is absent or present in their body, it can affect the metabolism of that medication. So sometimes it's always important. For example, um, if you are talking about carbamazepine, carbamazepine is another high yield something. So these people from Asia, you have to screen them for this enzyme. Okay, that is the gene before you start this medication. So the pharmacogenomics is how a person's gene, so somebody's gene can actually affect their response to a medication. So this early is highly associated with fetal carbamazepine therapy induced Steven Johnson syndrome, and it can cause toxic epidermal necrolysis. So it's very important to know that. Then we have what we call first pass effect. It's high yield in the exam. So all oral drugs must go through the first pass metabolism before they can be released in the body. A few are also broken down into small intestine by the bacteria, in addition to being metabolized in the liver. So some drugs cannot be given oral route simply because there is not enough of the active drug left after metabolism. So what is this telling you? When somebody take medication, let's say oral medication, when you swallow a pill, it will go through all this process from esophagus to the stomach to the small intestine to the portal circulation to the liver metabolism, okay, and then to the systemic circulation. But some medication, you cannot take them through this route. So because if you take them through this route, there will not be enough of that active drug left after metabolism. So one of those medication we mentioned is insulin. Then we have drug metabolism. It can be metabolized in different areas. We have talked about those medications that can affect the kidney. Is a high yield in the exam. NSAID can affect the kidney. Okay. ACEs increases hyper or the risk of hyperkalemia, high potassium. Warfarin increases the risk of bleeding. Then lithium increases the risk of kidney injury. Okay. So it's very important to know these medications that can affect the kidney. Okay, so this is another important slide that you can see in your exam, questions on that. So these drugs are responsible for a large number of drug interaction. Like I said, these these drugs, like when we mentioned the macrolides, okay, drugs that act as inhibitors slow down drug clearance, which increases the risk of drug overdose. So we have what we call inhibitors and inducers. So inhibitors, I use I to remember I. It increases, okay? Inhibitors, the inducers, D, it decreases. So these medications here can do what? It causes inhibitions. It can slow down when you are on this, for example, when you are on antipsychotic and you are on any of these medication, let's say you are on macrolide, it causes inhibition, so it was going to slow down the drug clearance, so thereby increasing the chances of overdose. So because it's going to slow down the metabolism or the drug clearance, is going to do what? Increase the risk of overdose. So that is why we say I. It increases the risk of overdose. So what will happen? They are going to reduce the dosage. Then you need to know medication that have narrow therapeutic index. Anytime we say narrow therapeutic index, what are those medications? They are those medications that you have to monitor closely. Okay, you have to monitor closely, and there are very important things you must monitor when patient is on that medication. So in the exam, you have to monitor warfarin, you monitor the INR. Digoxin, you have to monitor the digoxin level, see if the person is having digoxin toxicity. You also have to know the signs and symptoms of digoxin toxicity. It's very high yield. Signs and symptoms of digoxin toxicity. Also, the electrolyte. So, when a patient has hypokalemia, low potassium, it can also cause digoxin toxicity. Then you have your theophylline. They have to check the theophylline level. Carbamazepine. So this medication, you have to check their blood levels. The levothyroxine, you have to check the TSH. And lithium, again and again, lithium, you have to check the TSH, check pregnancy, and also check kidney. H2 antagonist and PPI. H2 antagonist. So when somebody have a GAD, we give them H2 antagonists. So remember the H2 antagonist, but the first line of treatment is your protein pump inhibitor. Protein pump inhibitor. The exam is really high yield in protein pump inhibitor because you have, for example, patients that have H. pylori. We say that we have two types of treatment: triple therapy and quadra therapy. If you talk about the triple therapy, we say that will be on clarithromycin, amoxicillin, and one PPI, or patient can be on clarithromycin, flagyl, and one PPI. So that PPI is omeprazole. We have other PPI, not just omeprazole. Then also when you do the quadra therapy, patients will now be on tetracycline, and because they are resistant to clarithromycin, so they'll be on tetracycline, uh, antibiotics, one antibiotics, amoxicillin, pep- peptidobismol, and also one PPI. So you must know is a must, the side effect of PPI is a must. It causes the risk of fracture. So you can see something like osteoporosis. It also increases the risk of pneumonia and C. diff. Okay, so you must know that. Vitamin K antagonist and thiazide safety issues. So for thiazide, we have talked about thiazide before. So also know the side effects of thiazide and also the warning. Then the vitamin K antagonist You also need to know, like anything that will cause bleeding, when a patient is on different kind of medication. So it's important to know the medication that can interact with vitamin K. So we call it the G herbs. So that is garlic, ginger, ginkgo, ginseng. So I believe we know all this. Ginseng is used for sex and drive. It's a herbal supplement for sex drive. Ginkgo biloba is for memory. Okay. Ginger can be used for inflammation, but always know that these medications can interact with vitamin K. It can also cause bleeding. We have other herbal supplements, and so these medications, for example, when somebody is on aspirin, those medications that can cause bleeding, you always want to discontinue it 7 days before their surgery. So the atypical antipsychotic, which is your Zyprexa, Seroquel, Risperdal, Zyprexa, Seroquel, Risperdal, they causes weight gain. So what did we say? You have to monitor these labs, monitor the TSH, monitor the lipids, monitor A1C, monitor the weight, monitor BMI is high yield. TSH, lipids, A1C, weight, and BMI. And metabolic syndrome makes the person at risk of weight gain. Like when somebody have metabolic syndrome, they have issue with their weight, diabetes. Bisphosphonates, if we remember bisphosphonates and what bisphosphonates is used for, we said we use bisphosphonates for um um um, um hyperparathyroidism, and also we use it for osteoporosis. So if you remember osteoporosis, which is loss of bone mineral density, you also need to remember the risk factor. Risk factor: Asian, white, skinny, sedentary worker, alcohol, smoking, Cushing syndrome, PCOS, um, so a lot. We talked about it in musculoskeletal, PPI, menopause, premenopausal. Always remember those risk factor of osteoporosis. So we say we give them biphosphonate, and in biphosphonate, you have to educate them. You can either see it as alad, alad, alendronate, or actinol. It's still talking about the same thing. Biphosphonate, alendronate, actinol. Biphosphonate is the umbrella word. So this patient, you must know the education. The education is they have to take it on an empty stomach. They have to sitting upright at least for 30 minutes. They shouldn't be laying down. And also, they take it on empty stomach. They take it full glass of water, because you want to avoid esophageal erosion or striction. So that is why you have to educate them on that. Satin or satins, you have to know your satins. And we say we have three: high intensity, moderate intensity, low intensity. Please remember those things, or the classification. Under high intensity, I use the acronym RA, which is the high intensity can only be in rosuvastatin and atorvastatin. Rosuvastatin and atorvastatin. We say that the high intensity is not found in the low intensity, but the rest of all the other statins is under moderate intensity. The only difference is the dosage. So the dosage is the difference in moderate intensity. but high intensity is RA, rovastatin, and atorvastatin. But because in questions, you can see questions like all of the following are low intensity statin, except, so they will include all the low intensity statin and they will include one high intensity statin. So you need to know. Another important thing with statin is that statin cannot be mixed with grapefruit juice, very high yield grapefruit juice. And also, um, patient has a risk of rhabdomyolysis, rhabdomyolysis, which is the breakdown of the muscles. So when a patient is on statins and they start having dark color urine, muscle pain, not bone pain, muscle pain, okay, with other symptoms, myopathy, okay, they have to stop the medication and they have to draw the lab. Other medications you have to pay attention to: inhaled corticosteroid is always high yield in the exam. So anything steroid, inhaled cortic, this one is inhaled. Always remember inhaled corticosteroid. Always remember it can cause growth deceleration and failure. So it can affect the growth of children. Very important. Okay. Another important one is the systemic glucocorticoid. So we in primary care of we are treating, we don't normally deal with systemic because it's like IV. But always remember the side effect, which is your cataract and osteoporosis. Steroid can lead to cataract and osteoporosis. So please pay attention to that. Then this is our beer criteria. We say that this is the um it provides you a guidance regarding the medication that should be avoided in patients that are 65 years and up. So I gave example: instead of giving patient first generation antihistamine, you can give them the Claritin. So this is our digoxin, very important. We talked about it already. But for digoxin, I want you always to remember that it can uh, the it can cause the toxicity, and you need to monitor the level. Okay. So when patient is on digoxin, you have to monitor their and they are on hydrochlorothiazide. You have to monitor their potassium level. And don't forget about these visual changes. These visual changes, very important. Okay, let's continue. So remember the visual changes, which is the yellowish, green, tinge, color vision. Anything that has to do with the color vision. We have the warfarin management. And these questions here, you always need to know when a patient have an INR 1 to 2, or the guideline, we have them already. When they have an INR 1 to 2, what do you do when you have greater than 5? When you have greater than 9, from greater than 5 and above, that patient is at risk of bleeding. So when a patient have elevated INR, that is what I said, greater than 5 and above, you know that they are at risk of bleeding. You educate them to monitor for nosebleed, monitor hematuria, petechia. All these things are signs of bleeding. Then when patient is on vitamin K, you also need to know the medications that the food that contains vitamin K. Okay, food that contains vitamin K. So you have to review when a patient is on vitamin K. You also have to educate them on the food that contains vitamin K. So food like kale, spinach, collard, mustard. These are the contraindication of some medications. We have covered it, but very important. ACs and ARBs is avoiding pregnancy, avoiding breastfeeding. We all covered this already. Because it's severe aortic stenosis, avoid the potassium supplement. We covered this already. High yield. Then ARBs, the same thing. Then potassium sparing. We say that it causes GG, gynecomastia and galacturia. So you also have to be careful with anything that causes hyperkalemia. Then beta blocker is contraindicated in respiratory condition, asthma, COPD, and do not stop abruptly. Do not stop abruptly. Very important. Do not stop abruptly. PDE5, PDE5. So this PDE5, which is the sildenafil, we say that this is medication we use for erectile dysfunction. So know the name. Um, we call it PDE5. We have the Viagra. Okay. So please, it's very high yield in the exam. Do not mix it with nitrate. You can call it nitroglycerin, isosobate, nitrate, please. Very high yield, PDE5. Then SSRI can cause um, serotonin syndrome. We have mentioned that. NSAID herbal supplement. So know the herbal supplement. We said it can cause the risk of bleeding. So that is your G, 4G, ginkgo biloba, garlic, ginger, ginseng. Hypertension management. So the first line of hypertension management for the exam is usually education, which is low sodium diet, lifestyle modification, lifestyle modification. Thiazide. Another important thing about thiazide, we have talked about thiazide, sulfur allergy. People that have sulfur allergy, okay? And the side effects, hyperglycemia, hyperlipidemia, it triggers gout. This side effect is high yield. Potassium sparing diuretics. So we have talked about that too. It's very important to avoid in situations that worsens potassium because it's a potassium sparing. And we talked about the side effects, gynecomastia, galacturia, hyperkalemia. Loop diuretics. So loop diuretics is the one that we said we use it is more for edema People that have more edema, we use it more. So that is furosemide and bumetanide. Please remember this medication, furosemide, bumetanide. So when somebody have severe fluid retention, that is loop diuretics you will use instead of the thiazide diuretics. So you still need to monitor electrolyte. AC inhibitor is contraindicated in pregnancy. AC inhibitor, it causes important notes. It causes cough. We talked about it. So when they experience this cough, switch it to apps. In pregnancy contraindications, so we have avoid it in pregnancy, is renal protective. So it protects the kidney and are preferred when patients have hypertension and diabetes. So when a patient have hypertension and diabetes, you are going to add ACs or ARBs. Calcium channel blocker, we talked about it. Monitored the constipation, monitor ankle edema. Beta blocker, monitor the side effects. Another side effect you must know, bronchospasm. So these are more new information to add. Bronchospasm, erectile dysfunction, fatigue. Do not use it in respiratory condition. Do not abruptly discontinue your beta blocker. Alpha blockers, we talked about it. The alpha blockers are used for BPH. BPH. So we said if a patient have BPH, you use alpha blocker. So you use the terazosin. But if they have hypertension and BPH, you use the terazosin, doxazosin. But if they have only alpha, only BPH, you use tamsunol, tamsulosin. Okay, so know your alpha blockers. Alpha blockers are the ones we use for BPH. Okay, and you must know the mechanism of action for alpha blocker. They relaxes the smooth muscle neck, improving BPH. So they are vasodilators. So please pay attention to that, their mechanism of action. And the only alpha blocker that we can use off label, this point is very important for people that have PTSD. You know, when someone have PTSD, we say that they have nightmares. So prazosin is alpha blocker, but that is the only one that is off label that is approved to use for nightmares for people that have PTSD. Tetracycline. Tetracycline is high yield in the exam because tetracycline, you can use it at least questions like Rocky Mountain spotted fever. We say that the first line of treatment is doxycycline. Um, Rocky Mountain spotted fever, then Lyme's disease. If they are greater than 8 years and above, we can use doxycycline, which is tetracycline. STD, we still use doxycycline. Chlamydia, we use doxycycline. So we have a lot about tetracycline, which is doxycycline. But one thing you need to remember is that they can cause permanent teeth discoloration. Permanent teeth discoloration. So that is why we avoid it in children less than 8 years. So that is why for Lyme's disease, we use amoxicillin if they are less than 8 years. And also tetracycline, doxycycline can cause photosensitivity. Photosensitivity. So it's very important to tell them to avoid the sun. So these are the places we can use doxycycline. Doxycycline. Doxycycline can be used as STD. It can be used in anthrax. It can be used in Rocky Mountain spotted fever. Okay. We can even use it another high yield in the exam, malaria prophylaxis. Please pay attention. That is very high yield. Malaria prophylaxis, doxycycline. Okay. Then these are the doxycycline. Under tetracycline, these are your doxycyclines. Doxycycline, minocycline, tetracycline. So people get confused. Tetracycline is the umbrella word or the umbrella classification, but there's another class called tetracycline in tetracycline. So we have doxycycline, minocycline, tetracycline. Okay, so like in treatment of acne, we use tetracycline. Okay, treatment of acne, we use tetracycline. Very important. So it's very important to remember that. And another thing to remember is that tetracycline, this point is very important for the exam. Tetracycline, it's avoid taking tetracycline 4 hours of antacid, iron, zinc, calcium, magnesium, dairy products because they reduce the absorption. And you must drink it with full glass of water, and it decreases the effectiveness of contraceptive pills. So when a patient is on contraceptive pills, tell them to use two forms of birth control. So macrolide, we have talked about macrolide. It causes QT prolongation. Another high yield, it worsens or exacerbates myasthenia gravis. They can ask you a question about a patient that have myasthenia gravis. Which of the following is contraindicated? That is a macrolide because it worsens it. Then you have your cephalosporin, and we already say that patients with true penicillin allergy may have cross reaction. So that means if somebody have true penicillin allergy, you should avoid giving them first generation cephalosporin like Keflex because there's still possibility that it can affect it. So let me know if you have any question.